I'm Dr. Leah Dill. I'm a doctor of osteopathy, and I've been here at Texas Bariatric Specialists for about 3 years. So, two procedures I'm going to talk about today are the Roux-en-Y gastric bypass operation and the laparoscopic sleeve gastrectomy. The first operation is the Roux-en-Y gastric bypass. It's been around for a long period of time. It's been done for several decades, and because of that, it's considered the gold standard. All the surgeries are done today with a minimally invasive approach, so that means small little laparoscopic incisions, which help shorten the operative time, also shorten your recovery time so you're back to work a lot quicker. With the Roux-en-Y gastric bypass surgery, we have a restrictive component where we make a small stomach pouch, and then we also have a second part of the surgery where there's a component of malabsorption. We divide part of the small intestine and then bring that portion up to the small stomach pouch, bypassing the rest of the stomach. And then there's a component where the food is going down the esophagus, then into the gastric pouch, and then into the small intestine where it's not actually mixing with the digestive enzymes. So we would expect most people to lose between 75 and 80% of their extra weight with this operation. So diabetic patients are going to benefit from this because when you change the direction that the food is going down and food enters a different part of the small intestine at a different time period than it normally would, that helps control diabetes. And that result is actually quite immediately. So patients actually leave the hospital taking no diabetic medications or at least a reduced amount. Acid reflux is also improved with the gastric bypass procedure. So most of the acid that we make is in the lower part of the stomach. And when we resect the top part of the stomach, we actually prohibit part of that acid at the bottom of the stomach from going up into the esophagus and entering it. So people who suffer from severe acid reflux might want to consider this operation because it could help cure that illness as well. The second surgery I'm going to talk about is another popular choice, is the laparoscopic sleeve gastrectomy. With this surgery, what we are doing is we're going to create the stomach and make it into a skinny banana-like shaped stomach. So we're actually going to trim part of the stomach and actually remove a portion of it. And anywhere from 60 to 80% of the stomach is actually removed with this surgery. So as you can imagine, the stomach will fill up with smaller amounts of food and you'll actually feel full eating these smaller portions versus a diet program where you're really trying to eat small portions of food but yet your stomach isn't full and you don't have that feeling of satiety or fullness. So the food will go down the normal pathway and there's no malabsorption with the sleeve procedure. It's a little bit quicker than the gastric bypass operation, so it takes about 30 minutes to perform the gastric sleeve, whereas bypass surgery usually takes about 45 minutes to an hour to complete. With regards to returning to work, for both of the surgeries are going to be about the same, since what most patients are going to feel is going to be the laparoscopic incisional pain, and most of that is very well tolerated by most patients. So most people are going to be able to go back to work in 1 week or 2, depending on what they do for work. If you have a job where you are at a desk or doing some administrative work, most of the time those types of patients can go back to work in 1 week. If you have a job that's a little bit more physically demanding, where you're having to stand, lift heavy things, or bend over, then you probably want to take 2 weeks off from work just to ensure that you're going to give yourself plenty of time to rest. If you are considering weight loss surgery and would like some more information, we do offer some free seminars. We find that that's a good way to have patients come to the office, get a little bit more information about what the next steps would be if they were interested, and really learn a little bit more about these types of procedures and learn which ones might be the best one for them. The best way to find us is at texasbariatricspecialists.com.